for joining us. We are excited to have you all here today. My name is Robin Al-Haddad, and I am the Community Manager for QualME, which is IDEAL's Qualitative Monitoring and Evaluation peer community. I'm happy to welcome you all to this learning session on qualitative sampling methods. And today we will focus on qualitative sampling strategies and selection criteria in the context of real-world case studies to examine sampling methods in practice. And this is, again, a peer community, and we want everyone to get to know each other. So we ask you to please introduce yourself in the chat box and go ahead and share your name, your organization, and where you're based. Also, before we get started, I just want to inform everyone that we are providing French interpretation during this meeting. Please click on the globe or interpretation globe at the bottom of your screen and select your preferred language, either English or French. Unfortunately, the interpretation feature is not available if you're connecting on your phone. And also, when we break into small groups later on, we will have a French-speaking breakout room. And if you have indicated when you registered that your preferred language is French, then you will automatically be assigned to a French breakout room. Otherwise, my colleague Bella Gertherfer here can help you get sorted. She's our technical lead for today's event, and she can help you get sorted into your preferred room. Also, just a reminder of a few basic house rules. So please remember to mute your microphone when you are not speaking so that we don't hear background noises. You can use the chat box or the raise your hand button if you have a question, and we will try to call on you. And we will try to answer as many questions as we can in our short amount of time. If your bandwidth allows, please also turn on your video when you are speaking so we are able to see you. And we are recording this session today, and we will send out the link to the recording after the event. So each QualME session has a different topic of discussion, and today's meeting we will focus on qualitative sampling methods. This meeting is not intended to be a training session, but rather give everybody a very brief overview of some techniques that are used to develop qualitative sampling strategies in practice. For our agenda today, first up, we will hear from colleagues from Gaia and ProWash and Scale activities, who will give us a brief introduction to their method of right-size sampling for inclusion and optimum saturation. Second, we will hear from a colleague from Tango International on the Resilience Evaluation Analysis and Learning, or REAL study that was conducted in Northeast Nigeria. And finally, we will hear from a colleague from Penn State who will give us an overview of the CRS nutrition study in rural Niger. Thank you all for joining us today. And after the plenary session, we will then break out into small groups for individual discussions and do a sampling exercise in the breakout rooms. Again, we are a community. We want to create a safe space for communication. So we encourage you all to share your experiences in the breakout room. All right, so we will now turn it over to Jess MacArthur from ProWash and Scale and Hope Shaken from Gaia to give us an overview and brief introduction to the right size sampling for qualitative research using a sampling calculator for inclusion. Jess MacArthur is the WASH Research and Learning Advisor with ProWash and Scale, and Jess holds a PhD from the University of Technology, Sydney, Institute for Sustainable Futures, where she focuses on monitoring and evaluating gender equality and social inclusion, or GESI, in WASH. Jess is one of the authors of the Qual Kit. And if you haven't yet checked out the Qual Kit, you should really check it out. It's got it's a great resource. It's a good toolkit that has several tools and techniques. So I encourage you to check it out. I think we'll post a link in the chat. The toolkit is very relevant to the WASH sector as well as other sectors. We also have Hope Shaken, who's the Research and Learning Advisor and for the Gender and Youth Activity, or Gaia. And in this role, she supports BHA-funded resilience food security activities and emergency programs to design and use qualitative methods to address their program-specific questions and depthen their contextual understanding of social inclusion, resilience dynamics of their activities in order to adapt programming for transformative change. All of our presenters will have an opportunity to answer your questions at the end of the 3 presentations. So we are asking you to hold all your questions until all of the presentations are final. Okay, now over to Hope and Jess.
So hello, everyone. Welcome to this session on right-sizing sampling for qualitative research. We're here today to discuss how to right-size and narrow in your sampling. We've created a sampling calculator to help you perform better inclusion in your programs. By using a sampling calculator focused on saturation, we can gather rich, insightful data that truly reflects the experiences of the people we're studying and that draws out dynamics of inclusion. Now, many researchers fall into the trap of thinking that the more interviews they conduct, the better. But that's not necessarily true. Have you ever heard of the concept of saturation? If you have, send an emoji in the chat if you've heard of this concept before. A couple of people.
Great. It's great to see some emojis coming in, lots of smiley faces, thumbs up and hearts. Lovely to hear that many of you are familiar and perhaps even experts on the concept of saturation. As you all know, saturation is the point at which you've collected enough data to identify all the key themes within your research topic. It's really the point at which conducting more interviews or more focus group discussions after reaching saturation won't give you much new information. It's just redundancy.
So the question becomes, how many interviews or focus groups are enough to reach saturation? Now, many recent studies have aimed to answer this very question. They looked at how many interviews and focus groups typically lead to saturation. And here's the crucial point. Most studies found that most themes were identified between 6 to 12 interviews per subpopulation. And go to the next slide, 3 to 6 focus groups per group of subpopulation. Now, these ranges of interviews are based on, again, the subpopulations of interest. In other words, if we're studying the experiences of young, unmarried mothers, this is our specific subpopulation of interest. And we might need 6 to 12 interviews or 3 to 6 focus group discussions with these young, unmarried mothers. The same goes for other relevant subpopulations like fathers or grandparents. So for each subpopulation you add, the more data collection exercises you might need. The other point here is that for interviews and focus group discussions, we're expressing this number in a range. And there's a reason for this. Remember, saturation is the point where no new themes emerge. And so it might take 3 focus groups, or it might take 6. And so we're trying to identify the range to account for this variability. Next slide. Now let's talk about a helpful tool. This is a sample size calculator for qualitative research. Maybe you've used one for quantitative research in the past. Now, this calculator isn't about finding a single magic number, but really, again, like we've discussed, a range to ensure we gather rich data. And just as a really quick note, the saturation is when you can basically guess what the person might be saying. So maybe you've done lots of interviews, and by interview 10, 12, 13, you're starting to guess that saturation. Now, here's how the calculator works. Imagine you want to study young people's experiences in different districts. These are very different geographies, District 1 and District 2. And you want to understand their perspectives both based on geography and by gender. This calculator allows you to consider these attributes, which go in the left-hand column. You can see their geography and gender. And then you add a column for each of the different types of geographies. So District 1, District 2, they each get a column, and young women and men get a column. Now, for each category within an attribute, you need to have these different corresponding columns. If we only have one attribute, for example, district, we need at least 2 columns, right? And if we want to add the second attribute, we need to add more columns. Now, the more attributes or categories that you add, the wider the range of population you need to speak with. So think about it like creating a grid. Each combination of attributes needs to be represented. And this approach helps us to achieve inclusivity. By ensuring we talk to young men and women in both districts, we capture a diverse and representative range of experiences. Now, at the bottom, you see we have between 15 and 30 activities, again, the range, and we've estimated that might take 2 teams, each doing 3 activities a day, 3 to 5 days to do. Now, keep in mind, we're always trying to make sure we budget, so try to make sure you're also including aspects for data entry as well. Over back to you, Hope.
Thanks, Jess. So as Jess alluded to, when you're thinking of it like a grid, the more attributes you add, the more districts you add, the more data collection you're going to need to do. So this is a real life example. In this case, the study had the research question, what are the different factors that have enabled men, women, and youth in households to recover effectively from shocks and stresses? And in this case, the program was really interested in sampling based on both geography, whether individuals were coping or not coping with shocks and stresses, as well as gender and age. But as you can see from this example, we really should be doing 3 to 6 FGDs or 6 to 12 interviews in each column. But because they had added so many attributes that they wanted to sample on, the sampling got blown up really, really quickly. And this is how qualitative studies get big and difficult to manage. So how can we draw a smaller boundary? On the next slide, you'll see 2 options that the team considered for how to narrow down on their sampling strategy using the sampling calculator. So option 1 was only doing their data collection with young women and sampling based again on geography, looking at zones and whether folks were coping or not coping, specifically young women were coping or not coping. So in this example, they wouldn't be able to disaggregate the experiences of adult women versus young women, or even compare the experiences of women and men, but they would be able to compare between different locations and those coping and not. Option 2 was only doing their data collection with people who were coping through shocks and stresses, and sampling based on age. So thinking about young people versus adults, and men and gender. So thinking about men versus women. So in the end, this program selected option 1, since their research question was really trying to identify the differences between young women who were coping and not coping, and look at this across multiple program locations. So if we're thinking about selecting 1 to 2 attributes to keep the sample size manageable, really, really important aspect, we might think about which attributes we should pick or prioritize to put into that sampling calculator. So this is an art, not a science. We really should be thinking about picking attributes based on ultimately our research question. So what is it that we're trying to learn, and who is it a priority to speak with based on that question? We should also be thinking about selecting the attributes based on who is best informed. So who's going to have the most direct information to answer your research question? And finally, we can think about who has differing information. So whose perspective might be missing from what is already known, or how might different groups' perspectives differ? So are there 2 groups that we want to be able to compare the perspectives of? And again, for a small study, we recommend really picking 1 or 2 attributes to keep the sample size manageable, thinking about 3 to 6 FGDs or 6 to 12 interviews per subgroup. Over to you, Jess.
So to illustrate this concept, let's delve into one specific research question. How do young male and female farmers perceive the concept of climate change? So this question suggests already that our first attribute will be gender. But we also need to understand between young men and young women. So what other attributes can we think about? Here's where we focus on new information. We might consider who has new information to share, maybe a population that's been overlooked or excluded. And we might want to think about comparisons, such as cyclone-prone areas versus drought, or different target populations related to disability, ethnicity, or life stage. You might also want to look at doers and non-users, such as adopters of climate-smart agricultural technology or non-adopters. And again, this allows us to compare. So why do we care about sample sizes? There's a few different pieces. Ethical reasons, respecting people's time, and survey fatigue. You might also want to think about your resources, time, money, and people. Also, data overwhelm. The more data you collect, the more you have to analyze. and it's often clearer to analyze data that is simpler and smaller. You might also be able to create clearer findings. These might not be generalizable, but are transferable if you are familiar with the qualitative research kind of paradigm. Now, what else? Do you have any other ideas? Can you add them in the chat? What other reasons why we might want to start with smaller sample sizes? We can always expand later, but thinking about the starting place is a great space to do. Back over to you, Robin. Thanks so much.
Great. Thank you so much, Hope and Jess, for that overview of just good practices on qualitative sampling and using the sampling calculator. Yeah, that's great advice. Remember, we always have to balance our ideal sample size with what is actually achievable. As you said, it's very important to keep in mind, ultimately, our sample size will be determined in large part by the research questions that we want to ask and who can answer those research questions, the available resources that we have as far as time and budget, and the practicality of our fieldwork, logistics, and our site locations. So overall, just remember that depth and the richness of your interview data is more important than the number of interviews. All right, next up, I would like to turn it over to Charles Meisch, who's from Tango International, to talk about the sampling strategy that was used for Tango's Resilience Evaluation Analysis and Learning, or REAL study, that was conducted in Northeast Nigeria. And Charles is a research associate at Tango International with experience in mixed method evaluations of resilience activities from the local to international levels. He has received his master's from the University of Arizona in the development practice, as well as in applied econometrics and data analytics. Charles supported the management of the qualitative research in the Northeast Nigeria resilience study, including sampling, data collection, and analysis. Now over to you, Charles.
All right, thank you, Robin. Let's get into it. Next slide, please. So I want to give us a brief background on the Northeast Nigeria resilience study. This was a mixed method study to examine key resilience capacities and well-being outcomes in target communities and systems. The focal activity was the rural resilience activity. This was a 5-year market systems development activity with layered peace building and short-term humanitarian assistance. Again, this was a complex market system strengthening activity. So this area was contextualized by high levels of displacement. It contained some conflict and climatic shocks. There was also considerable economic and food insecurity across the 4 states. You can see the 4 states in the image here. We had Adamawa, Borno, Gombe, and Yobe. Next slide, please. So this complex situation presented some challenges. This is a complex setting with various geographical components, as well as an adaptive activity that was aiming to target multiple market system strengthening activities, as well as different services. So that left us with a question. How do we capture a range of perspectives from a diverse set of communities and stakeholders in a way that is feasible, appropriate, and comprehensive? Well, let's take a look at this question. Next slide, please. The research questions for this study. We had 2 research questions. The first one, in fragile contexts, what intervention sets contributed to increased resilience capacities which help households mitigate and recover from shocks? The second one, what are the dynamics of resilience activities in areas experiencing high levels of displacement? So this brings our attention to a couple of key components. The rural resilience activity contained multiple intervention sets that targeted essential market services, such as farming and financial services, both formal through banking and informal through local VSLA groups. Really wanted to understand how these contributed to increased resilience capacities for households and how the households mitigated and recovered from shocks. The second one brings attention to the levels of displacement in the area. So we want to think how these intervention sets impact people that may be coming or leaving from these areas. Next slide, please. Let's take a brief look at the methodology for our study. Again, this is a mixed method study, so we had a quantitative and a qualitative component. Today I'll be focusing on the qualitative, but briefly, the quantitative component It was a panel study with a multi-stage cluster design. It was sampled to be representative of the RA target area. It contained both household and community questionnaires. The qualitative proportion of this study was purposely sampling strategy. It meant that we had certain key criteria that we used to select our communities. The qualitative portion contained gender-separated focus group discussions and key informed interviews. These were designed to complement the quantitative survey tools. Next slide, please. So let's take a look at our selection criteria for our qualitative sample. We had a few key areas you see here. We wanted to make sure we were capturing a mix of RA interventions. This meant both through our interviews and focus groups, we want to ensure that we were speaking with people who would benefit or may not be benefiting from these areas, specifically farmers. We had some financial service providers, and so on. We also know that RA distributed cash transfers, so we want to make sure that our focus groups had some members that had received the cash transfers, so we could be picking this up in our data. We also wanted to understand the displacement characteristics of these areas. We were able to use IOM data to supplement this. And finally, we want to make sure these communities are accessible, secure, and feasibly accessible. That is both an RA sampling criteria that they wanted to make sure that these activities had the capacity for growth and they were accessible for these market services, as well as to do no risk, do no harm component. These criteria were informed by our initial qualitative assessment, which took place before the 4-round RMS that we did. We also utilized RA baseline data and secondary data, such as the IOM data, to really complement and understand these selection criteria. Ultimately, we drew a sample of 12 sites based on this purposive sample, and it was designed to complement the quantitative sample. It was also drawn from the same area that the quantitative sample took place from. Next slide, please. Here I want to talk more about our sampling approach for this complex activity. After we established our sampling frame based on that previous criteria, which consisted of 12 purposely selected sites, we were able to make real-time adjustments to our sample during the data collection process. This was an ongoing adaptive process to ensure a range of desired stakeholder perspectives. Throughout this data collection process, we maintained flexibility, and we were able to make round-by-round adjustments. We worked closely with our Nigerian research partner, BOL, to ensure coverage and find possible replacements for market actors that dropped out or were not able to be interviewed across these multiple rounds. We also collaborated closely with RA throughout the entire process to track operational and contextual changes. Next slide, please. Here I want to talk more about our sampling approach for the focus group discussions. You see here that we have round 1 through 4, and they were gender segregated with the same number of male and female focus groups. In round 1 and round 4, we had 12 male and 12 female focus group discussions. In round 2 and 3, we had 6 male and 6 female. This was done for multiple reasons. Round 2 and 3 contained fewer focus groups to reduce the burden on the participants, as focus groups are known to take considerable amounts of time. It also meant that round 1 and 4 left us with a solid baseline and end line to really delve into the depth of community perspectives. Round 2 and 3, we had fewer focus groups, but that meant that we were able to sample additional market actors and community groups to really delve into that portion of our data collection. Next slide, please. Here I want to talk about our key informant interviews. So you see here a range of the market actor types that we were sampling for. You see that round 1, 2, and 4 might have slightly different numbers. So it's done for a variety of reasons. Again, we want to maintain flexibility, so we were capturing the perspectives of sufficient number of service providers from the RR area. We kind of broke this down into 3 groups. We had the core market services, such as financial service providers, commodity traders, agricultural service providers, ag input suppliers, livestock input suppliers. After round 1, we realized there were some more local businesses that we could be sampling for. So round 2, 3, and 4, we added fixed shop kiosks, and we noticed from focus groups some food sellers and market that were being impacted. So we were able to include these in our sample for future rounds. And we also sampled for our community groups, such as savings groups, youth groups, and farmer cooperatives. Finally, in round 4, we knew that RRA was starting to roll out the Ukraine-Russia cash transfer. So we were able to create some additional interviews with these staff, so we could really get more of that perspective on the cash transfer, the humanitarian assistance portion of the study. So total, we had 32 in round 1, 56 in round 2 and 3, and 32 in round 4. Next slide, please. Finally, I want to reflect on our sampling. A couple of questions we ask ourselves at the end of the day. The first one is, did the sampling strategy reach saturation for our population of interest? Overall, yes, the qualitative data did contain adequate diversity and depth. We feel that through sampling the multiple market actors and purposely selecting these sites, we captured rich and varied perspectives and insights on those key areas that we were wanting to sample for. Another big question we asked ourselves was, how did the qualitative sample contrast and complement the quantitative sample? Well, overall, we feel the qualitative component was successfully elaborated on important quantitative findings. We were able to provide new insights as well as additional insights on some of the quantitative findings, such as livelihood strategies and the nuances of ESL activities. We also feel that the qualitative sample helped highlight and give voice to the psychological impacts of the shocks and stresses. It's one thing to see a food insecurity metric, and it's a whole other thing to really hear the stories from the focus group participants and how they really were impacted by it, the stress, and how they coped. And overall, we had several excellent quotes that really helped bring our findings to life. Thank you very much.
All right, thank you so much, Charles, for sharing that overview of the real Nigeria study. Okay, finally, we will hear from Dr. Stephen Kaddish, who's from Penn State University, who will give us an overview of the CRS evaluation of maternal and young child nutrition outcomes in rural Niger. Dr. Stephen Kaddish is an associate professor at nutritional sciences and behavioral health at Penn State University. Stephen is an applied social and behavioral scientist who is trained in international health at Johns Hopkins, as well as Harvard Schools of Public Health, prior to joining the faculty at Penn State. Steve has worked professionally for 15 years as both a consultant and principal investigator aiming to improve maternal, infant, and young health and nutrition in support of low and middle income countries. He has worked on research in support of the World Food Program, UNICEF, International Fund for Agricultural Development, the World Bank, International Rescue Committee, and many others across more than 25 different Asian, African, Latin American, and Middle Eastern countries. Now over to you, Stephen.
Great. Robin, can you hear me?
Yes, I can.
Okay, excellent. Thanks for that very nice introduction. And Charles, what a lovely presentation and nice segue to a geographic area just north of where you were working. So we'll travel to French-speaking Niger now after leaving Nigeria. Next slide, please. Next slide, Bella. And I'll talk very briefly about this program evaluation, which is essentially what I'll describe today, or at least the sampling within it. CRS, Catholic Relief Services, has been implementing what's called GIRMA, and GIRMA is a large-scale program with 11 different components serving more than 800,000 people from at least 2020 to 2023. Our program evaluation focused on 3 different program modalities. So the SILK groups, which helped to improve financial literacy and savings and loans. Our care group model, which focused on nutrition education for moms in particular, as well as that social support piece. And then finally, this new addition, which previously was called Smart Couples in other settings, but was adapted for this setting, as a way to enhance couples' communication, satisfaction, and also resource allocation within the home. And so we wanted to know, how were these interventions being sequenced and layered to reach their outcomes of interest? Next slide, please. And moving left to right through our theory of change, the idea, very simply, and this is a simplified version, was that the combination of attending and participating in these 3 different types of groups or sessions for men and for women would lead to better marital quality and satisfaction, better access to finances, higher nutrition education and attitudes and normative views, and altogether lead to a greater household level intention to have more diverse diets for moms and for infants and young children. So we have program components here. We also have different types of participants, if you're thinking ahead, for sampling purposes. Next slide, please. And let me introduce our aims. First was really a quantitative aim to understand the effectiveness of those 3 intervention modalities on child diets. Number 2, to understand those pathways. And if we were not seeing impacts on maternal or child diets, where along those pathways may have the plan been breaking down or the program not working as planned. Aim 3 was an embedded process piece. So how well was this intervention or these modalities being implemented according to plan? And finally, to generate recommendations. These 4 questions really could be answered statistically, but we added a light qualitative component to contextualize, to explain why and how we may have been seeing these impacts on diets, and particularly why and how the process of intervention was occurring. Over. Or next slide, please. Great, next slide. And this was a mixed method of evaluation. It was meant to be a cluster randomized controlled trial, but we had challenges in the field, and as a result had to modify it to be a prospective non-randomized design. We had a baseline survey in March 2022, and a year later, an end-line survey. Our qualitative piece was conducted 6 months or halfway between those 2 time points. And the timing of that has implications certainly for sampling. Next slide, please. And I like to use this picture of a car, not my car, I wish, but of a car that if it wasn't working so well, who would you try to recruit to help you fix it? Would you stand on the corner of the road in your town and talk to everyone who passes by to do so in a convenience type of sample? Well, no way. You'd say, Steve, I'm going to look around for a mechanic. Actually, I want a mechanic with 10 years of experience, and I want a mechanic who has a good reputation and has lower costs than other mechanics. And actually, I don't care about gender. Right? So what you just did to find a mechanic was essentially a criterion-based or attribute-based purposive sampling approach, which is exactly what we do in qualitative research. Our study aims for this GIRMA project focused on impact and process. So we want to talk to both moms or caregivers who are experts on child diets, but also the implementers of silk groups, care groups, and MFH sessions. So start to think now we have these different types of participants. The challenge with this evaluation that it was large scale. We had 3 study arms, study arm 1, study arm 2, and a control group. And that presents challenges because just like Hope and Jess pointed out, we're starting to see a lot of different attributes or criteria to consider expanding our sample size. The geography also tends to matter. In Zinder region, where we conducted this evaluation, there were over 620 villages. Well, should we sample from each village to be representative? That wasn't feasible, and that probably isn't necessary. So our study arms were a little bit more important than our geographic units. How do we sample relative to our survey? Do we want to interview or sample the same individuals who are survey participants, or just individuals who are similar in profile and living in the same catchment type of area? For any kind of maternal and child and infant nutrition project, everyone on this call probably is aware of all the different life stages from pregnancy until and through adolescence. And that creates a real challenge when you're thinking about participant type, because there are a lot of different life stages you might consider. In this evaluation, we had interviews, focus groups, and direct observations of child meals. And so the data collection method really determines also what type of participants we like. In this setting, the focus group discussions needed to be gender specific. So focus groups only with husbands, focus groups only with wives. And that was a cultural rule that we wanted to follow. And that had sampling considerations or implications. Sample sizes, as my colleagues have pointed out, are always of great interest. The one thing I will say above and beyond what has already been said is just that it also really depends on the breadth of what you're investigating. So I've seen a lot of studies with an interview guide that's 10 pages long, and it covers every type of nutrition concept known in a textbook. Well, if you're covering so many topics and the breadth of the research question or inquiry is so wide, it makes it very, very difficult to have saturation with just a few people. So the more topics, the greater breadth, from my experience, typically the greater sample size might be needed. And secondly, just like statistically, we power a study down to the lowest stratum. We want to do the same for the lowest stratum in qualitative sampling. The cultural context matters, which I mentioned before, and Charles nicely talked about feasibility issues. We did not conduct this fieldwork ourselves. We partnered with the University of Zinder, and University of Zinder had a short subcontract to be able to do this in a very cross-sectional data collection approach, which did not allow for the nice iteration that Charles illustrated in the Nigeria study. And also, we faced some major language challenges where we were collecting data in Hausa, but it was then translated into French and then into English. And as each of those steps occurs, more and more meaning can be lost. And so that has sample size implications. Next, please. These were our final sample sizes, just to give you a sense of not necessarily the numbers, but really the different, how those different criteria or considerations on the previous slide really informed where we ended up. So we have the different study arms on the left that were considered. We have the different methods with various sample sizes. Gender was a big consideration, and actually these are husband and wife couples, given the MFH focus on couples strengthening. We have both impact or participant data collection, as well as interviews with those MFH facilitators for a process-related focus. I could talk to you for 20 more minutes about this slide, but I'll just stop there to give you just to give you a sense of how those considerations went into determining these final sample sizes. Next slide, please. Great. And I'll just say that I like to think about qualitative research oftentimes as a detective. And if I were a detective trying to solve a crime, I would probably go interview Robin first. And then based on what she tells me, I would go interview Hope. And based on what I learned from Hope, next week, I'll go and observe Jess or the crime scene. And then I might go take my information to 5 other detectives in a group and bounce my ideas off them. And then I might go in a few days to do interviews with 2 more people who were around the crime scene. And that, to me, is really the strength of qualitative research, or its potential to have that really iterative approach from beginning to end with multiple different methods, not to be collected in this very cross-sectional way with 10 to 12 participants. But actually, when you get enough information to solve the crime, you can stop sampling. There wouldn't be a point to continuing. We don't have this luxury in the public health programmatic qualitative work we typically do, but I try to strive for it when we design qualitative studies. The one thing I will mention here is that our sample sizes, they looked quite large, I think, from a qualitative perspective on the previous slide, but really our data were quite thin. But because the data were collected in a cross-sectional way, we didn't really know how thin the data were until months later when we were had the translations and were analyzing them. And so really the sample sizes may not have been sufficient relative to the level of saturation and all the different attributes and criteria that we had. So some lessons learned, but also some very programmatic realities on the ground that informed our decisions. Thanks very much. I'll hand it back to you, Robin.
Great, thank you so much, Stephen. Yeah, we always hear with random sampling is considered, the gold standard for quantitative methods. So I really like your explanation and that metaphor of the car and fixing your vehicle. Why we would use purposive sampling approaches for qualitative research samples. So I appreciate that. Thank you. All right, now we have a few minutes for Q&A, so I just want to open it up to the floor and see if anyone has any questions for our presenters. Please feel free to either raise your hand or write your questions in the chat, and we'll get to as many questions as we can. All right. Rumbi, go ahead.
Thank you very much. So I would like to sort of find out, the first presenter talked about a calculator, sample calculator. Is it something that's freely available? Can people access it? Thank you, that's my question. Over.
I can jump in and share. Yeah, it definitely is. I'm going to find the paper that it draws from. This is not just Hope and I's brain. This comes from some great work from FHI 360's team and their qualitative research unit. So I will find the paper and share it, but we will be actually trying it a little bit later in the session, and you can use that version as well. Just copy and paste it. But yeah, not just Hope and I. Lots of great brains have gone into these types of things. And maybe just also to note, there were some really great examples throughout in the final two presentations that talked about different market actors or community leaders. And that isn't necessarily the best use case for the calculator. It's normally used when we're working with community members that might be kind of participants in our programs.
All right, yeah, thank you. We're going to try it out in the breakout rooms in just a moment. All right, I have a question for Charles that was in the Q&A. What are the dependencies between the three terminologies, research questions, methodology, and sampling? How you select 12 males and 12 females from your population sample size? I'm not sure who actually asked this question. Maybe the person wants to come off mute and explain. It was asked by Ernest.
Hello?
Yeah, Ernest, did you want to explain the question or ask the question?
Yeah, I asked my question to Mr. Charles. I would like to know the dependence between those three terminologies, which research question, methodology, and sampling. How research question can influence to know methodology which you can use during your end line survey or end line research, and how your methodology selected can influence the number size or sample size from your population you have. And my second question is, when you are using focus group discussion, and I think you don't pick a number by hazard. You must have any formula which you can use to select your number from your population. Now, when Charles was presenting, he has shown us a table where he had a 12 male and a 12 female. I would like to know which formula he has used to know or to pick these numbers from his population. Thank you.
Sure, that's a very good question. So first, yeah, the research question to methodology to sampling,
Yeah.
it really does kind of flow that way, that the research questions really made us know that we wanted to understand some of the intervention sets. So we wanted to make sure we were capturing community members who were in the value chain that RA did. So that meant we were sampling specifically for farmers. We wanted to capture male and female perspectives. We wanted to understand cash transfers. So we wanted to purposely select some community members that had received the cash transfer. And in an ideal world, without research constraints, as Hope and Jess laid out so well, these might be individual attributes. But because of the size of our study, we kind of focused on including these attributes within our focus group sample. And how we settled on the focus group discussion numbers, well, a leading criteria was the geography. So I didn't show it, but it was loosely quantitative was a population-based geographic sample. So the quantitative component was representative of the broader rural resilience activity in those 4 states, Adamawa, Gombe, Borno, and Yobe. And because of that, the focus group discussions ended up being roughly corresponding. So I believe we had like 5 in Borno and then 3 in the other states, or like, yeah, 3 and then 2. And that way we got an idea of the quantitative sample in our qualitative by sampling based on the geographic determinants. And again, talking about kind of the attributes you mentioned, the research questions and the methodology sampling, we outlined those qualitative criteria, which were again kind of those value chains. And how we did that was just like Steve said earlier, it's really, really helpful to work with your local research partner to get a sense of who is in the community and speak to the people you need. Because just like he said, there's language barriers. So we had the community leader helped us understand it, our research partner, and then working with the focal area rural resilience activity, they also helped us understand which communities might be the best fit to capture the attributes that we kind of laid out.
All right.
Yeah.
Thank you, Charles. Thank you. I do see Paul has his hand up. Go ahead, Paul.
Hi, can you hear me all right?
Yes.
I think my question's for Stephen. You mentioned something about your transcript not being in depth enough and that sort of affected your sample size. So I wanted just to get an idea. Say you've got a population like we've been talking and you sample your population, but if you've got a lot of interesting questions you would like to try and understand, but your budget's limited, do you err and make the questionnaire shorter and keep your sample size the bigger, or is it better to have a smaller sample size and then spend more time going in depth in the questions? Or do you ever have to trade off, and which one do you trade off first?
That's the age-old question, isn't it? Brilliant. But I think just like everything in life, there has to be a trade-off. We don't have all the resources and all the time to do everything we would like as investigators or implementers. For me, the strength of qualitative work really comes not in large samples and population level evaluation or investigation, but really in answering a specific question in an in-depth way to understand why and how something is occurring. And so if I were to err on one side or the other, I would say use that budget for a smaller sample and a more in-depth qualitative study. Or if you can use that same money to do a large-scale survey and then touch on all the different topics you're interested in, that could be a nice first step. And maybe a funder would find that your findings are interesting and then give you some follow-up funding for maybe a more comprehensive qualitative study. Yeah, that's how I would approach this. Over.
All right, thank you. I see a question that was in the chat about, I think it's from Renee. What were the usual duration of data collection using these qualitative sampling? I've done these before, but it's taking so much time. I'm not sure who this question is for, but I guess she's interested to understand how much time it took. If Charles or Stephen wants to give an answer to that.
I can just jump in real quick, Charles. The qualitative piece of our program evaluation was too short. I think data were collected, the field work was conducted in, let's say, 4 to 6 weeks, which, given those sample sizes, did not allow for translation and transcription and any level of analysis concurrently, which would be the ideal, that at least we have some sense of findings that are emerging that can help inform maybe what we do next week or next month. I will just say that if you want to have that iterative nature in your qualitative work, try your best to build it in the beginning and see what type of appetite your management team or your funder has. And it'll probably be abbreviated a little bit, but my experience is that the longer you have, the more iterative you can make it, which is truly should be a strength of qualitative work that we don't take advantage of enough, I think, in our field. Over.
All right, thank you. Paul, did you still have another question, or have you just not put your hand down?
This could be a different Paul.
Oh, sorry. Go ahead.
Yeah, it's all right. My name is Paul Letoya from DRS, and great question. I was actually inspired by Paul's question on trade-offs, and listening to Stephen talking about context. I sort of wanted to hear about, especially when you're talking about special populations, and you want to do like translation of scripts. What has been your experience? And you had a very good experience where you had to adjust your sample in the field. What would you say when you have to translate, do translation, or even apply some participatory methods, especially if you're talking to like a specific group like the youth or something and you want to be more engaging? Yeah, over to you. And Charles, you can chime in too.
Just to kind of add on, Steve said it pretty well, and in the ideal sense, it can be iterative, and ours took about 4 to 6 weeks, and we went in person to help with the data collection with the training of our local data collection team and build some report. And I feel that really helped us throughout the data collection process to have these policies in place. And for us, we had weekly debriefs across the different teams. And because we were able to have these debriefs, it meant that to some extent, we had initial translations. And so we were able to dig into some of those initial themes that were emerging and really make sure we were capturing what we needed to be doing. So in our case, we before we even started, we set this as a goal to have, like, every Friday we would have a debrief with the different teams. And that was one way we were able to have that more iterative process of growing and making sure we're capturing the data we need to be. Over.
All right, thank you. I believe we are at time for the Q&A portion. So I will leave it at that. And you all are welcome also to ask questions when we're in the breakout rooms. All right, so now we are just going to take about 30 minutes. We're going to go into our breakout rooms and go into our small groups for some discussion on sampling, and we'll do a sampling exercise. You will be randomly assigned into a breakout room, and a message will pop up letting you know which group you are in. You will need to click join the group. And once you get into your group, there is a link for the sampling strategy document. You can open up that link. You should read the instructions at the top of for the exercise on page 1, including the scenario and the research questions, and then propose a sample of respondents that you would select to answer those research questions. And in order to do that, you will first fill in column A, labeled under selection criteria, with all the attributes or characteristics that your team will identify that you would like to speak with. And next, you will fill in the remaining columns under sampling frame with the number of sampling units that are needed for each category. Again, the instructions are at the top of the document. Please read the instructions, and the link for the activity has been posted in the chat. We will see you here back in about 30 minutes.
I think,
Sorry, what?
All right. Welcome back, everyone. I really hope you all learned something in the breakout rooms. Thanks again for everyone for that great conversation. I think our group talked a lot. So to our presenters, Hope Shaken, Jess MacArthur, Charles Meisch, and Stephen Cottish, we greatly appreciate you taking your time to share your knowledge with our community. And thanks to everyone who helped us in our breakout rooms. It was really great to have these sort of exchanges of good practice and communication. Thanks to Bella for being our technical lead today. And unfortunately, it's time to wrap up today's session, but I do have a few announcements before people jump off. As a final request, we will ask you we appreciate it if you could please follow that link that has been posted in the chat for a very short evaluation about today's event. Because it helps us enhance future events and make them better. We will also send out a follow-up email in the next few days with all the materials from today's session, so don't worry. It will include the decks, the slide decks, and the recording of the session, and all the links that we're highlighting today. And then just a couple of short announcements. We have before we wrap up, I just wanted to remind people that IDEAL does have a qualitative M&E e-course that you can take. It's out now. The first one is Designing Qualitative Research for Monitoring and Evaluation. This is a step-by-step guide that uses our qualitative M&E guidance toolkit. It's based on IDEAL's toolkit. And second, we have another course that is coming out any minute. It's called Qualitative Data Management and Analysis for M&E. It's coming out really shortly. It should be out within the next couple of weeks, so be on the lookout. It should be out by August 12th. And finally, also be on the lookout in the FSN newsletter for any upcoming events that we have in our QualME series. We can also continue this conversation on LinkedIn. We now have a new QualME group that's on LinkedIn, and we'll post it in the chat. So yeah, please find us there and continue the conversation. Again, thanks to all and have a great day.